I think firstly we've got lung cancer screening, which is on the way, which is great, but that's not going to solve the problem, because a lot of people who develop lung cancer, we know they wouldn't have been eligible for lung cancer screening, because lung cancer screening focuses on the most high-risk population. And also a lot of people who are eligible for screening don't choose not to participate. So picking up people who have symptoms of lung cancer is still going to be really, really important. Detecting lung cancer in primary care from the GP's point of view is actually surprisingly hard, and we know a large proportion of patients have to see their GP 3 times or more before they're referred onwards to specialists. And we know there's a longer period of time between people seeing their GP for the first time and then being referred onwards than for most other cancers. So it's actually a surprisingly difficult diagnosis to make, and that's because a lot of the symptoms are quite general and quite common in general. So the most common symptom of lung cancer is cough, which is really, really common in general. So it can be quite hard for GPs to know which patients in which to suspect lung cancer. Some of the ways we can get over this, what we were talking about in the presentation, was we could encourage GPs to have a lower threshold to consider using chest X-ray as a basic first investigation for patients, even those who are at fairly low levels of risk for lung cancer, because we probably need to cast the net quite wide to diagnose as many of these patients as early as possible. Both. So people who have smoked and people who haven't smoked. So people who have symptoms. So the symptoms are very common in general, and it's not just cough. There's chest pain, shortness of breath, also things like findings in blood tests like raised platelets. So there's quite a long list of symptoms that do warrant consideration of a chest X-ray. And one of the barriers also that I haven't mentioned is that we know from some of the work we've done that the sensitivity of chest X-ray is only around 80%, so it doesn't pick up all lung cancers. But even so, from some of our other work, we've shown that there's a lot of variation in how much general practices are using chest X-ray. So there's general practices that are using chest X-ray quite a lot, and some that aren't using it, or are using it a lot less. So although chest X-ray is not perfect, there's probably still scope to increase how much we're using it to pick up more cases. One of the solutions potentially is increasing access to CT for GPs, so what's called direct access testing, and that's been announced by NHS England that all GPs should have access to that for patients that they're concerned about. That's really positive. There are going to be some big barriers to actually making that happen on the ground. We don't know yet what the impact of that announcement has been, whether it's actually changed things. One of the things I talked about in the presentation was it's really quite hard actually for GPs to categorize people into people who they think are high risk for lung cancer and people who are low risk. The symptom we have that's the best indicator for lung cancer is hemoptysis, so coughing up blood, but only a relatively small proportion of patients actually have that symptom, and the other symptoms mostly don't give us a very strong steer as to whether lung cancer is there. So in this kind of context, I think one thing we can do is probably use chest X-ray more for people even if they are at fairly low levels of risk, accepting that it's not a perfect test, because probably as well as the barrier we've talked about, which is the problem with chest X-ray not picking up all lung cancer cases, another barrier is that a lot of people aren't getting any test at all, CT or chest X-ray. So I think if we could get more patients who have symptoms, a basic test like chest X-ray, we could probably pick up more cases. And actually some of the work that I talked about today that we've done looked at comparing patients who attend general practices that have a high rate of chest X-ray use versus practices that have a lower rate of chest X-ray use. And we found actually from our data that hasn't been published yet, we found that that patients who attend practices with a higher rate of chest X-ray use are diagnosed with earlier stage disease and also have improved survival as well.